Okay, let's get started now. So in today's class, we are going to talk about two topics, okay? Informed consent and confidentiality. Another most important, I would say, for the exam for sure, okay? Minimum 1 question on each, maximum 10 questions on each. It's a highly weightage in the exam for sure, right? Now we'll discuss the concept first, right? And whatever information I write it down here, this is not mostly everything given in the Saunders book, but still you need to read the Saunders book after the class, okay? I still recommend it because it's an important topic, right? But this is the to the point main information. If you can make your notes, that will be great for this one, okay? So we'll start with informed consent first. What is informed consent basically? So understand the basic meaning first in a simple language. What is informed consent? So informed consent, let's say if I ask, let's say to you Kamal, like I'm about to teach you this chapter right now. Do I have your permission to do it, right? So you will be like yes or either no, right? As a verbal consent, this is what I'm going to do is informed consent. But in informed consent, we are not just asking the question, can I have your permission? Apart from that, we are also providing information at the same time, like to everyone, what exactly you need from them or why you're doing this procedure from them. So let's say the same example, I'm going to teach you this chapter today, right? But I think this chapter is very important for you for your exam and you will get the more benefit from this chapter. Is it okay for you if I teach you Kamal about this chapter? So did you notice I try to explain you everything, reason behind it, why I'm doing this thing, right? And then after that I get the consent from her. So this is we call what? Informed consent. After the patient being informed of everything, then you get the consent from the patient, either verbally, either written. That is we call the informed consent. Very simple language, right? Because in the books I know there's a lot of definitions, right? But this is what the meaning exactly of the simple language. What is informed consent? Now we're going to talk about in terms of the medical languages. So first of all, this is a lethal and ethical requirement for sure. Lethal and the ethical requirement. So lethal and ethical requirement means like this is the legally something we're supposed to do it, number one. And ethically we have to follow it. You know, whenever you take the informed consent on the patient, we are talking about topic today, informed consent and confidentiality. Just start it now, okay? Feel welcome. So now what is the definition? The client participation in making decision regarding healthcare. As I said, whenever your patient participates in it, right, to make those decisions, this is we call informed consent when you take a consent from them. Now, this is not just informed consent, meaning where the NCLEX will ask you the question around. They more ask you these question informed consent related in the form of surgery related or in case of an emergencies as well, right? When patient going for surgery, when there is an emergency, when there is a non-emergency situation, how would you proceed with the informed consent in those situations, right? So the first thing I'm going to talk about in terms of the surgery, right? So in surgery, always remember when you have a patient in front of you and the patient is about to go for a scheduled surgery or a procedure, let's say, right? But it's an invasive procedure, right? Now you need to get the informed consent from the patient. So first of all, a lot of nurses don't know about this question. Who is responsible to take informed consent? Remember, it's always the person who is going to perform the procedure, right? Not the nurses. The person who is about to perform the procedure. So number one answer, if you have in your answer key, is the surgeon, the person who is about to perform the procedure, right? But if the surgeon option is not there, then do you have a physician somewhere? Write it down in the answer key. Yeah, you can go for physician also as a next answer if the surgeon option is not there, because that person will come as a next. Like basically the direct physician doctor who is dealing with the client care with that specific patient, right? Because this is how they got decided that patient need a surgery for something. I'm going to assign someone to do it and see if we can collaborate, have a meeting together and go for this specific surgery for this patient or a procedure. So basically you try your best to find out the surgeon if you can, but if you don't have that in the answer key, sometimes they don't give it to you. Can you go for surgeon? The answer is yes. A lot of nurses, they ask me, what about the charge nurse in this case? The answer is no. The person who is performing procedure, right? Those doctors are responsible because surgeon is also a doctor. It's just they are doing the surgery, right? So basically you go for these two answers in that scenario, the person who is going to perform the invasive procedure. But if it's something like a non-invasive procedure, something as a nursing procedure, you are the responsible person who's supposed to do that procedure with that patient. But how do you take the consent? Verbal or written, it depends what kind of procedure is this, right? So for example, if I'm taking, let's say, one of my client with me right now and I'm taking his blood pressure, right? So simply just take the verbal consent. Is it okay for you, Mr. X, if I take your blood pressure right now from your right arm, right? So this is we call the verbal consent, but you still have to take it, right? Any nursing procedure you're doing on the floor, before you touch the patient anywhere in any situation, irrespective where you're going to work after getting the RN licenses, you must need to explain the patient and get the consent from them before you touch the patient, okay? Or before you teach anything even about it. Always get the consent, because I know this is a lot of difference between the nursing practice between some countries, developing countries, or the already developed countries. Because as you remember, in back home, most of the countries, like, we just go and put the blood pressure cuff because you think it's important for you to, for the patient to do it, right? But here, if you do that, it will be a big trouble, right? So definitely always ask the patient, say something, explain it, and after explaining, then get the consent. Sometimes the NCLEX ask you these questions also, like, are you going to explain first and then get the consent, or are you going to get the consent first and then explain the procedure? What do you think in this case?
Explain first.
Sorry? Explain first. Very good, right? So Kamal, you said the consent first. So if you get the consent first and then you explain why you're in the room, doesn't make any sense. So let's say if I get your consent already to teach you the topic today, but after that I'm explaining you why I'm teaching, you will be like, what she's doing, then why she get the consent first? I don't know why she getting the consent first, and now what she's doing after this, right? So that doesn't make any sense in the steps. But if I explain you first, why are you in here today inside the room, and then I get your consent after that, then you will understand more. Does it make sense? Kamal, you have a confusion, seems like? Any question, any doubt in your brain?
Like, if I say, okay, can I take your blood pressure? And like the patient said like yes, and I'll explain them like why it's not gonna happen like that, or I'll just go and
so basically you explain first. That's why you said, can I get the blood pressure, right? And then you get the consent after that from the patient. The patient will tell you yes or no. So this is what I'm trying to say. And in the explanation, you include at the same time why you're doing this before you get the consent from the patient, yes or no. Does it make sense now?
Yes.
Okay, perfect. So back to the surgery related, the way we were talking about, this is the role and responsibility to explain anything about the surgery upcoming. It could be the purpose, risk, benefit, complication, anything. If you don't go for this procedure, what could be happen, or what could be the alternative options, Mr. X, if you don't go for this surgery. Anything, it's explanation, it's done by them, not by the nurses, remember, not even RN, not even the LPN. But do you have some role in here, nursing responsibility? The answer is yes, right? Being as an RN, you need to witness the situation in front of you. The surgeon needs to explain, or the doctor, whoever the person is coming, that person needs to explain in front of you, right? And you need to do the witness of the situation. Now, when you're doing witness of the situation, remember, you need to remember few things in there in your brain at the same time. Number one, you need to make sure you're cognitive. The patient is cognitive enough to make a decision, mentally capable enough to understand the information, and then to ask the questions if they have any at the same time. So that means not the client who are mentally ill in this case, right? But something where they're cognitive enough and they know how to make a decision in that case. Number two, you need to make sure as a nurse at that time, standing in there, that patient do understand everything in there about the procedure, what the doctor just mentioned to them. So basically, is the patient able to grab the information or not? This is your job to do the witness into that situation. Number three, you need to make sure all information is going to be provided, not just the superficial explanation by them, right? If something superficial, this is your job to remind the physician at the same time that patient has a right to get all the information in this case before they sign for the informed consent for this upcoming surgery, right? Bless you. So basically, when you're doing witness as an RN, right? In this case, you need to make sure you apply all these things before you actually sign in there as a witness as an RN. Now remember, the nurses LPN, what they can do in this case, if they are basically dealing with this situation. LPN can also go and stand in this situation as well, but the LPN still need one RN with her before she signs for the witness, right? If just in case this is the LPN patient, she needs the RN at the bedside at that time to sign for the witness situation. So basically, you still need the RN when you're doing the signature for these things, right? I hope it's clear until here. No questions? Any doubt, any question for me? Yes, Fruta?
As an RN, do we make sure the consent is signed?
Yes, as an RN, you make sure the consent is signed. So basically, you make sure it's signed, and that's why you're doing the witnessing the situation for everything. And when the patient is signing it, you do basically witness that situation by following all these rules in there. Does that make sense?
Yes.
Yeah, any question until now? No confusion? Okay. Very easy topic. I try to arrange everything like in a simple, easy format, and believe me, whatever written is in here, whatever I'm talking, question can come out of from any single line, right? So you really need to understand everything in there, right? So now, the next thing I'm going to talk about it, what about if your client changed the mind, maybe during conversation, right? Or even remember after even signing the paper, or even let's say a patient is already in the surgery area right now and they're about to perform the surgery, and the patient has an anxiety or something and they have a doubt or question further, what to do in that case? Does the patient has a right to cancel the consent in that scenario? Yes, definitely. This is not something like you got the signature, everything on the paper, now the patient cannot basically cancel it. Yes, the patient can cancel everything in there, even in the last minute of the procedure. But what you do as a nurse, as an RN in that situation, if patient has a further question, you think, or even if you notice from their face that the patient seems like in a doubt at this time and do have a question about it, right? Or if you think the patient changed the mind, right? Now this question can come in two different methods. Number one, sometimes you notice some clue from the face. Maybe they are trying to explaining you or a facial expression, or maybe they're saying like, let's say for example, I'm feeling anxious right now about the upcoming surgery. Now in the question, I did not really tell you anxious about what, right? So definitely, if there is no further information given in the question, like this is regarding what patient is trying to say, is this something patient has a further question for me or not? In that scenario, the first answer is you try to explore first from the patient by asking the open-ended question, like, can you tell me more about it? What makes you feel anxious at this time, right? So sometimes they don't give it all that information and they really want to know what are you going to do first and what are you going to do next, right? So if the explore is not done in the question yet, you don't know what's in there, or you just see the expression, patient seems quiet, upset, sad right now, you better explore first if it's not being done in the question yet. But Sometimes they already mention everything in the question. Maybe the patient already tell you like, okay, I don't want to go for upcoming surgery. I think I can't make it. Oh, I think my sister, she had a same surgery before. I don't want to make the surgery to proceed. So basically any reason, patient already mentioned into the question. You don't have to explore back into there because it's already understandable that this is something what the patient don't want to proceed, right? So in that case, the first answer immediately, what you're going to do is call the surgeon. Very good. Lot of time they will give you another option as well. Explain the patient the importance of upcoming surgery, or explore the reason, or check the feeling of the client. You know, this sounds really good, all those options, but do you really need them? The answer is no, right? Because you cannot do anything in there in that scenario. So in that scenario, you need to call someone immediately because your patient changed the mind in this case, and now another paperwork. They will come back again to the floor and sit with the patient, explore everything, what makes them to feel this way, and explain all the procedure and see if the patient still wants to go or not. Right? So the second consent will go for sign in this case. Any questions until here? Any question in your brain? I can see Fruta has a question for you.
I was just saying, if the surgeon already explained everything, and they have a question like, can you reinforce?
So you mean to say if the surgeon already explained everything and the patient has a doubt now to go for surgery, so can you reinforce the teaching or not as an RN? Okay, well, if the doubt is related to a general question, right, about the upcoming surgery, let's say the patient just want to get reminded again, oh, can you tell me back again what was the complication? The answer is yes. You can reinforce the teaching as an RN again, but not as an LPN in this scenario, because you need to collaborate back again with an RN. It's about the upcoming surgery, so for safer side. But if the patient has a question for you, a different, which is something about the surgery related, or forgot what the doctor says, are they going to give me sedation, or they're going to just do the procedure like this, like how we are going to perform the procedure? So sounds like the patient doesn't understand anything in there, and you need to make sure they get all the information and understand before they sign for the informed consent. Does that make sense, right? So basically, in that case, you call them, right? Because now another consent is going to be signed. Seems like you witness situation, but now the patient doesn't understand. Did I address your question, Fruta? Okay. I want to make sure I address everything in here, but this is what you do in these conditions when the patient changes the mind. Now, let's talk about is there any requirement for the patient to be valid to sign for the consent, right? So the first thing is voluntary. When they're making decision, they're making decision voluntary. It's not something the doctor is the best friend, right? Or maybe it's another healthcare person working in the same hospital. They're trying to pushing the patient, oh, you need to go for this procedure. Just trust me. They're good staff members, right? Or it's not something the family is at the bedside, right? And they just want the patient to go for surgery in this case, right? So patient decision needs to be voluntary in this case, not to be forceful by anyone. Number two, as I said earlier, they need to be informed first before they make a decision. Informed about everything, all the procedure, what I just mentioned earlier, what the surgeon is going to explain them. Number three, the patient is competent enough, alert mind, oriented to time, place and person, and understand everything before make a decision for the informed consent. Pretty simple. And the next one we have is the legal age, right? So it's not like a minor. It's like 18 plus needs to be in there, right? Now remember, when you get your license as an RN, it depends where you work. After that, in Canada, in States, what state or province you're gonna work in there after you got your license, or Australia. When you work in there, then your province guidelines are a little bit different, because it's always keep changing by those health authorities as per the province wide what they can do it. But for the NCLEX, you only gonna simply remember 18 plus. That's it, right? So 18 plus only we're gonna consider the age for the examination. But always follow the guideline when you work in what city or area after you got your license in there. Then you don't just cram this information in there, right? Now, the last thing is language understood in this case. So basically, whenever you are trying to explaining something to the patient or the surgeon, you need to make sure they do know the same English language like in which the doctor is communicating, because if they don't understand that language completely, even if they have a doubt or they want someone as a language translator person or interpreter, so in that case is you need to find someone in there, right, before they sign for the informed consent. Now tell me the answer, especially I'll ask this question Amritpreet in this area, because I think Fruta know the answer, maybe Kamal know the answer as well. So Amritpreet, what do you think? Do you think the family member, they can translate it for the patient if they are at the bedside? Are you going to request the family member to translate the information?
No.
No? Okay, then who is going to translate then?
I mean, if I have okay, from family side.
Like my question is, do you think who is going to translate this one for you, like for your client? So basically you think the family and friends, they can translate it for you, right, or for the patient? Or do you think you're going to find someone? If you need to find someone, then who is the person you're going to find it? Do you have any idea?
Yes, okay. Yes, family can explain.
Okay.
Because they know better and it can help with the language barrier.
Okay, this is the, okay, where I'm gonna make you stop, because I know pretty much 70%, especially international graduated nurses, they don't know the answer for this question. I would say more than 70%. Because most of the time, now again, this is a difference between the nursing practice, what we done earlier and what's in these countries, right? So there we try to involve the family members, whoever the personal first caregiver, the person know the information and they know how to basically, you know, communicate with the patient. But there's a big difference. We do not involve the family members or the friends or anyone in here, okay? What is the reason? Breach of confidentiality, a big issue, right? And second thing is, do you think the family and friends, whatever they're talking between each other in the same like native language or whatever, do you think the family explain everything to the patient? Is there any guarantee, right? Because we don't understand what they're talking about in their language in that area. So in that case, the answer is always remember, guys, for the NCLEX, do not find the family members or the friend or caregiver, whoever, to translate for your patient. Doesn't matter, it's an invasive procedure related, you need the consent, or non-invasive procedure. So who you gonna find? You find the hospital interpreter staff, right? So basically you check in your facility if anyone knows the same language in this area. Mostly every hospital has a one translator person and they know multiple languages in there, but sometimes they can find from the floor as well a different staff member who can speak the same language, right? So for example, if we are all working in a different site, imagine if I'm Amritpreet right now, my patient, and I'm the nurse right now, maybe she speaks Punjabi or Hindi and I don't maybe speak in case Punjabi or Hindi, then maybe I'll ask the Kamal, like, Kamal, do you know about this language? Because you are another nurse working on the floor at the same time. Now I know that this is not your patient, but I need to involve you now directly in here for the healthcare purposes reason. So only for the information what she need to know, then only I will share that information with her, not everything again, right? And then this is her responsibility to come in and explain everything for us together and make sure the patient understand, got all the information, everything in there. And definitely you will sit with the doctor. Whatever the doctor says, you need to translate at the same time, Kamal, right? Mm-hmm. So I hope that makes clear, right? So next time, do not click the answer, family member, friends, or whoever the person is in there. It's always the staff member what you're looking. So hospital staff or hospital interpreter, the one person who know the answer, okay? Right? So this is something you want to remember for the next time for sure. Now let's see, is there any situation where the consent is not valid, right? So I'm going to talk about, yes, if your patient is not cognitive enough, as I said, or maybe your patient is having had a sedation just earlier, right? Patient cannot make a decision now, right? Or if your patient is minor, right? Or if there is no interpreter staff available. Now, a lot of nurses, they ask this question, what if it's an emergency, right? Then do we still need to find a staff member to translate the language and everything? Now we're going to talk about these exceptional areas, right? So the first one is emergency. What about there is an emergency situation, right? Do we still need to get the consent and everything from the patient? Because we want to maybe proceed in emergency situation, maybe for a surgical procedure, maybe it's just a regular nursing procedure, or like it could be anything, but something in emergency you think you want to do it right away. You can't wait because you want to save someone's life, right? Or even you don't know what is the identity of that person either also, and you don't know where to find and how to explain, who to explain in there. Basically, any emergency situation, you do not need the consent or anything in there. If you cannot find any relevant POA at the bedside with a family member who you can talk to and get the consent in case of an emergency, so don't waste your time. In emergency, simply proceed, right? Now the second one is minors, right? In cases of minors, you always need to remember is try your best if you have the parents or guardian at the bedside, right? Even if it's an emergency or non-emergency situation, right? Non-emergency situation, if you have the parents or family member at the bedside, it's good. But if you don't have it, then in that case for the minors, you need to now go through the court order, right? In the non-emergency situation. You need to get the court order for them because it's a non-emergency situation. I can wait for this lab test or procedure, but let's get the court order on the behalf of it so we can proceed with the procedure with the minor later on, right? But if it's an emergency situation, now it's a minor in front of you, the parents maybe went for a vacation somewhere, they're not coming back for next 5 days and so, or you cannot hold them on the phone also, right? What to do in that situation? As I said, emergency is emergency, irrespective of the age. You just proceed. Whatever you can do is to save someone's life, right? Now the last one is court-appointed guardian. Sometimes there are court-appointed guardians, we have it, and that guardian can take the decision on the behalf of the client, even if the patient can understand cognitive enough or not cognitive enough, right? Usually like your mental health clients, they always have appointed guardians or POA. Right? So they can take a decision on their behalf. But even if the patient is capable enough to make a decision, you can take the guardian court order valid as well if needed. But in usually capable enough, you directly have to ask the patient first. You don't really need them in that scenario to ask them first those questions if they're not at the bedside, right? Now, I think I covered up everything in here about informed consent, the basic content information, what you needed to handle any single question, right? But as I said, after this lecture today, please refer Saunders' book, line to line, okay? This is very important. I think this is given in your ethicals and legal issues chapter, right? You can refer to your book and read about the rest of the information there as well. Maybe for your reference, I can tell you right now, what exactly are the things they give you in there. They give you like types of the consent. Well, you can read it if you have time. Types of consents are not really important because NCLEX is not going to ask you direct question like how many types consent is there, 1, 2, 3, 4, 5, 6, right? This is a low level question you should not expect in the exam, right? And they also talk about, I can see a nice box in here about mentally or emotionally incompetent clients. So yes, if you got some time to read about this, let's proceed because it's a good information in that box in there, right? After that, they give you a little bit few points, and all those few points, it's already covered up majority in here. I don't think so anything is missing, but it's still a good idea, you know. Have a nice reading of your Saunders book after you know the class, because this is how you're going to remember the knowledge part mostly when you revise something after this. Now, I'll take a little bit pause in here. If you have any question for me in the informed consent, let's see, Kamal has a question, I guess.
Like in emergency,
Uh-huh.
if there is a family member is coming with it,
Mhm.
so then we can explain, then we can add a family member as an entrepreneur or no?
Like for the translator,
Yes.
translator would never involve the family member. Never
Ever.
ever. Doesn't matter it's an emergency or it's a non-emergency, right? In emergency, you don't need a translator basically. You just proceed because you don't have time enough to find someone on the floor to go and proceed with the language. But who are you going to explain in emergency? Patient is already unconscious or semi-conscious, cannot make the decision enough right now, right? Does it make sense? Okay, let's think more question if you have. Yes, Fruta? I can see a question in your face now.
In case of the interpretation,
Uh-huh.
another nurse can interpret.
Yeah, if she knows the language. As I said, I give the previous example, like she's working another nurse with me on the floor, right? If she knows the same language, you can request her, but only give that patient information what she needed, right? Just what she needed, because she's not supposed to get all the healthcare information, but you only share what you think she need the most to handle the situation in that case for you. Yeah. Any other doubts?
I thought only interpreters can do that. I didn't know that one.
Like all the interpreters can do what? Sorry?
Only the interpreters can
Mhm.
interpret.
Yeah, it's a staff member.
That's how I
Yeah,
got it.
because whoever you're finding interpreter, the translator person on the floor, that's actually a staff member of the hospital, right?
Okay, so there
Yeah.
are no people like dedicated for interpretation.
That's a dedicated, but that's a staff member of the hospital, no?
Yes, but
So it's still a staff member. But if you're looking for something from nursing, yes, you can,
You can
right?
get-
Yeah, you can find someone if you think that's a person who know the language and they know about all the rules and information that they cannot share the client information after this to someone, right?
So in hospitals, there are people who their job is
You try to find the dedicated person first if you can. But if you do not have the dedicated person available for some reason, and now you want to try another person on the floor, yes, you can. Mhm.
But in real life scenario, are there?
We do the same thing
There
in
are
real life scenario.
interpreters?
Yeah, there are interpreters. Yeah, you call and see if there's someone available right now in the hospital.
And
Yeah.
that thing only work for the surgeries or like even
For anything, even let's say something like a non-invasive procedure. Let's say the client has a new admission on the floor, right? But you want to try to explain the new admission person about all the paperwork for new admission, or what are you going to do in here, and you want to collect even information from the patient as well. But the patient, let's say, imagine speaking Chinese language, right? And you don't understand the Chinese language. How can you collect all the health information now? So definitely call your staff or the hospital interpreter, as I said, the first person, if possible. Yeah.
But family can explain like what is happening with him, right? Like if
You can gather the data from family member, whatever they know all the information, right? But not something you're supposed to share all the health information by the client, with the client. Yeah. Yeah, you can involve the family basically. I'm not saying that the family always keep it out of the box. Active participation of the family is also required. We also look after their feelings and everything at the same time too. But at the same time, you want to keep in mind confidentiality, right? And you want to find still another resource to verify the information as well,
you
right?
just want to make sure
Mhm.
that patient understand everything like that,
Yeah.
not family member.
Yeah. So basically, we don't involve the family member in translation, anything, because in that case, there will be breach of confidentiality, number one. Number two, you don't know if all the information shared between one channel to another or not, what they're talking to each other, right? How we can verify now, right? That the patient knows everything, or maybe patient, trying to saying something to family member, don't send me for this procedure, but the family forcing, no, you need to do it. Right? So how come we know what they're talking in that Chinese language in there, right? If you don't know that language, then how we can be reliable in that information?
Even if family members ask you about the patient, also you don't tell them, right?
Yeah, we're going to talk about confidentiality in the next section. Yeah, they are very close to each other. Yeah.
Maybe it can be a very common question.
Uh-huh.
So even we have no one other than the receptionist, or only she knows the language. So still we gonna take her as a
She is who?
the receptionist.
Like-
I mean,
Like as I said, you try to find the dedicated translator person first from the hospital, right? Just page your staff members, see if they're available, right? If the staff member is not available, then any staff member from hospital who know the language, right? It could be nursing department, non-nursing department, any other, but someone who can help in that situation, but it has to be belong to hospital staff.
Because they already know the breach.
Yeah, because they already know about the health rules and everything in there. Yeah, because whenever you guys go for your job, you sign some paperwork before you go on the floor, right? And you already know there in the paperwork, I'm not going to share the patient information with anyone in there. Yeah. Does it make sense? See, it's an interesting topic today, right?
It's very
Very interesting topic, and it's a very important topic, I would say, for the exam. Okay. So I hope there is no question in here, but you can always come back to this one, right, if you have any question in there. And yeah, now we're going to talk about the confidentiality in this case, right? So in confidentiality, what is the confidentiality and what do you need to know exactly about the confidentiality for your exam? So confidentiality is basically, first of all, understand the meaning. The meaning is duty to protect the patient private information, right? It's your job, your duty to protect the patient private information. That is confidentiality, simple meaning. Keep the information safe, their medical records and everything. I'll talk about that, right? Now, this is definitely governed by one of the HIPAA Act, what we have in the US, right? So we definitely need to follow the confidentiality in here, and it's a big thing, let me tell you, because a lot of time when you do not think about confidentiality, you're gonna get the warning letters as per the sites policy, whatever you have where you're working as a nurses. Most of the sites, they give you a warning letter first about the confidentiality. If you did something breach on the floor, it depends what type breach again you did it, right? If it's something less serious or more serious, they will look after. If it's less serious, most probably a warning letter first by your managers and then fired without even telling you, right? But it depends, as I said, sometimes it's very serious. Something you did it, no warning letters, just fired, right? I remember there was a news a couple of years ago from UK, from Queen's family. Someone just gave the birth to a child, right? And I was reading this news on the Google. I think it was a very famous on social media at that time. And then the nurse who was working in that area, who helped in delivering the child, definitely she was very excited after seeing the baby. And when she come out of it, when everybody asked, you know, about the baby, she actually tell the gender without the patient information, you know, consent and everything. And guess what? Deported back.
Deported?
Not just the fired, right? So again, it's the country rules also depends again, but confidentiality, guys, it's a big thing. You really need to save your license. See, passing exam, nursing, NCLEX is not only should be your goal, right? Your goal needs to be to make your license safe all the time. Right? So for example, if I say something right now about my previous patients in the classes, how it's going to look like, right? Do I really need to share that information in there, right? So no, the answer is no, I don't need to talk about them. Definitely then my license will be at the risk, right? So you really think before you speak at the workplace with anyone, with your patient, with your staff member, family member, whoever, colleagues, right? Because you really need to know what involves in confidentiality, what you can say, what you cannot say. Be cautious, right? Otherwise it can be a lot of suitcases as well on your licenses, right? I'm not making you scared, telling you the reality, okay? Now, what is your role in the confidentiality? Kamal is thinking now, oh my God, confidentiality is a big thing for me, right? So no, I'm not making you scared, Kamal. Remember guys, you're gonna make it because you're gonna learn everything in here now, and now you know how to present on the floor, right? Now, the first thing is share the information only with the member of the healthcare team. Whoever the person involving directly in the client care, remember directly, not everybody else on the floor, right? Even let's say you're 4 nurses or 3 nurses, 3 of you, 4 of you working together today on the floor, right? Do you really need to share all the patient information with each other with your assigned client today? The answer is no, right? You only get the information in the shift report of your patient, and you keep it to yourself because you're providing direct care with your patient. Doesn't matter you working as a UAP healthcare aide or you working as a LPN, you're working as an RN, you keep the information to yourself. Don't share the information with someone who is working in the next door with a different client because they don't need to be, right? Even if they're working on the same floor, okay? If the person is asking you, hey, can you tell me the medical records of your patient lab results? I see you got a celebrity today on the floor and that's my favorite crush since childhood, right? I want to know the information. Simply remind the staff about confidentiality in the answer key. You cannot share the information in there, in any case, okay? Now, second is provide information only with the client consent. Only with the client consent. Whoever you're sharing information, let's say you got a wife of the client on the floor today and she wants to know something about the patient diagnosis or maybe what medications you're using, or it could be anything, or maybe it's a brother, sister, daughter, son, whoever coming on the floor, they wants to know how's my dad information today on the floor. Can you tell me what medication you just give it right now? Any healthcare related information, you're not supposed to share it without the patient consent. Consent could be just the verbal or it could be the written consent with your patient. Majority of the sites, they do the written consent for the safer sites, right? But you can also take the verbal consent as well in some scenarios if your patient is not like in that condition to sign it. Is it okay for you, Mr. X, if I share this information with your wife, right? Are you okay with that, right? So basically, you explain the patient and get the consent first before you share it. So simply answer to those questions. When the family comes on the floor and they wants to know it, there could be two answers better in there in the answer key. Number one, if you want to write it down, simply remind them, I'm sorry, I'm not allowed to share this information, like due to the confidentiality. Usually they don't write I'm sorry in the answer key because I'm sorry, we don't use it really in the healthcare. I'll talk about that in the therapeutic lectures. Communication, therapeutic and non-therapeutic. It's my upcoming classes very soon. But usually they will tell you like in the answer key, like I'm not allowed to share the information about the client due to confidentiality, right? Or the second best answer, if you don't have this answer in there, right? Because a lot of time, NCLEX is smart. They know you know this answer, right? But if that information is not there, the second better answer is simply redirect the family member to ask directly to the patient. This is also another better answer. Why? Because in that case also you're not again breaching confidentiality, right? You're simply basically reminding them to ask the patient directly, but I'm not gonna share the information in there, right? Same thing, if family member calls you, right, over the phone, and somebody saying, hey, I'm the person, this, can you tell me about all the patient information today? Well, if you don't know who they are, not to share. But if you know the person is POA, they have authority to get the health information, then the answer is yes. So anybody who has basically the patient, they can make a decision on the behalf of the patient or they have a consent from the patient, then yes, you can. But if not, then it's not, definitely, right? Then the next one is protect the medical records, verbal reports, and electronic data. This is your job, being as a nurses. Save the patient information, all the medical records, any verbal reports, even written reports, any electronic data, anything in computer, you're writing down off the chart, maybe on paperwork in nursing station. This is your job in your duty, right? To protect the file and all the information, that nobody sneaking in there and reading all the information in there. But what if you find someone is reading patient chart right now? What are you going to do? So what is your action now? Any answer?
Stop it. Stop.
Very good. Stop it and remind the staff you're not allowed to read the other patient information due to confidentiality. But what about if I ask you another question now? You're this staff member doing this mistake again and again.
Report.
What are you going to do now? Report it second time, right? Report it to who? Supervisor or the charge nurse, whoever you have on the floor. See, pretty simple. This is we're also gonna learn in the line of chain of communication strategy, which I'll bring up one day for all of you. There I will tell you in what situation go to charge nurse to report it, in what situation not to report it. You can handle by yourself with the confronting someone on the floor. So those are really good examples I'm going to talk about on that day, scenarios, and then we'll learn a lot on that day as well. So moving on back to confidentiality, examples, right? So definitely reports are the example. In nursing station, whatever you're talking in a private setting about the patient, close the door so nobody outside in the outdoor area can listen the information. Use the client attention on assignment. Sometimes the student nurses also working on the floor and they want to create some assignments for the client too. So they're not going to write down the complete patient information in there or the full name. They're just going to write down initial, right? So basically keep the confidentiality in there. So if any nursing student watching this is something they need to know. Log of computers. After you guys doing your documentation, this is your duty to shut down the computer. Don't leave it behind in there that okay, I'll go to patient first, do my physical assessment, then I'll come back and write on again and close it again. No, every time you're okay, so the video was stopped for some reason in between. I was talking about log off the computers, right? So remember, you always log off your computer wherever you're doing the charting, right? Make sure after you're using computer, you always turn it off. Do not think I'll go to the patient first, then I'll do the rest of the charting, right? So you always log off your computer, or if it's not a computer charting, if it's a paper charting, make sure you close the file properly and leave it in a safe area where a lot of people, they're not going to be go around and read the information for the client. And then after that, do the next nursing assignment what you have. Now, the next one we have here is provide information directly to the client or the legal authorization person. As I said, you can only give the information to the patient what the patient information is regarding they have and they need to know, or the POA, the one I was talking about earlier, right? So you really need to let the POA know as well. All the client related information, what do you think, what the POA needs to know, right? Now, the last thing we're going to talk about in the confidentiality is about some example which actually tells you that you do breach the information of the client. So breach of confidentiality, some common examples. Let's see together. Discuss the information in the public area. So if you're discussing about your patient information in a public area, let's say you go to the grocery store like a Walmart and one of the family members say, hey, I saw you yesterday, right? You were taking care of my mom and dad as a nurse. Can you tell me how my mom and dad is doing today, right? In that case, you simply tell the family member that I'm not allowed to share the information outside in the public area, or you simply tell them to contact the charge nurse on the floor to gather the information about it, because you cannot release the patient information or discuss about it off duty or in public areas, right? Now, the next one we have is look at the patient chart that is not assigned to you. As I said, sometimes, the other co-workers, they want to come to you and see the patient information, or they want to ask you. Do not share the information with them, because this is not something their patient assigned it today on that day. Even if they have that patient yesterday, right? Still, you do not share the information with them about your patient information, what they are asking you in that scenario. Now, the last thing I want to say here is sharing the client information with friends, family without consent. As I mentioned earlier, when you release the information with anybody who is asking about your client and you do not have the consent for that, you just mention about it, like how they are doing today, what exactly medications they took it today, definitely that is a breach of confidentiality. Without patient consent, you don't do this. And the next one I want to add in here is phone call, right? Now, phone call related breach confidentiality means, let's say if somebody call you in the nursing station and they wants to know that, okay, I'm calling from as a part of this family member, I wants to know more about my patient, right? Remember, you can only share the information with them if you think you're confident enough that person has like signed the paperwork, or the PUA person is talking over the phone and they are the designated, like the legally authorized person to get that information. Otherwise, if you're not sure about it, it's better not to share the information. Please save your licenses always, right? Sometimes the nurses are like in a doubt and they're like, I don't know if I'm talking with the same person or not. In that case, try your best to see if you can get some help with a charge nurse, with a co-worker, someone maybe know about them. But if none of the person around you, they're sure about who you're talking to over the phone, it's better not to share the information. You can simply tell them we'll share the information with you when we see you in person in our facility, right? Now, co-workers related breach confidentiality examples. So let's say two different co-workers today, they're talking about the patient maybe like during the lunchtime, or maybe in a cafeteria, or let's say in a hallway outside the patient room, or it could be the near the nursing station, right? Or maybe in the lift when you're using the elevators to go from one floor to another in hospital setting. So anywhere, wherever you're sharing the patient information with each other, or you guys are talking about the patient in that like in that area, which is not supposed to be the right place for you to talk about it, that means you're breaching confidentiality. And if you see someone on the floor doing like this, it's better to remind the person about confidentiality. So go and confront the staff and just simply tell them about the confidentiality. But remember, if they're repeating this mistake again and again, or second time mistake even again, you need to report to the nursing supervisor or the manager, right? Now, that's all about for the topic confidentiality, and the one we discussed today in the informed consent. Now, this is all about the class for today, but what I'll do here is I'll give you guys some homework. After you watch this lecture, right, or when you go home, all the students, when you go home, what you need to do is you need to practice some questions on these topics. I already created some question for you. I can send you either in the WhatsApp group, the one we have with everyone together, or you can also access the file of the question under the description box on the YouTube when I uploaded this video in there. So you can also access the question in there as well with the right answer key. Now, if there is any doubt, any question from me? No? Nothing really? Okay. I can see your faces. There is no doubt for me. Okay, well, thanks so much for joining today, and I'll stop the video right now and we'll see you guys in the next lecture.